Laser hair removal.
Now, we've all heard about it. Maybe we've even thought about doing it, but what does it really involve?
So joining us now is Dr. Steve Dayan, a plastic surgeon and assistant professor at the University of Illinois. It's great to have you on the 11 a.m. show.
Yes,
today.
I'm glad to be back here. I got to sleep in today, so it was kind of nice.
Yeah, thanks for being here. We thought about you before summer started because,
Yes.
you know, that's an important time. But actually, that's one of the fascinating things about laser hair removal is once you do it, after a few times, you're not going to have to worry about it as much. So let's start from the beginning. How many treatments does this usually take?
Well, that's a great question, and it varies. Everyone's different. Some people, a couple treatments to get a great result. Some people takes 10 or 12 treatments. It's really hard to predict. But generally speaking, the lighter the skin and the darker the hair, the better the result.
Really?
Wow.
Yes. So if someone's really light skinned, they have really dark, coarse hair, they get fantastic results, maybe 3 or 4 treatments, and they have hardly any hair. Really? But then people who have like gray hair or red hair or even blonde hair, it doesn't work so well, no matter what laser we use.
That's interesting.
You know,
okay.
So it just means more times.
it means
Right,
more
eventually.
times, that's right.
But is it still worth it?
Well, that's a good question. It depends on the person.
Okay.
Now, a lot of patients who I have who have peach fuzz, we do the laser on them, and even though that's blonde hair, they still get a very nice result. It slows down the growth of the hair, and they're very happy. It doesn't remove it completely, but it makes a nice difference.
Is it painful?
Yeah.
You know how I am about
that
these
Tracy
sorts of
will
things.
ask, and she said it. Well, does it hurt?
That's a great question. For most people, it really doesn't hurt them. Well, of course, it hurts more for men than for women for some reason. I'm not sure why.
Oh, I know why, but go ahead.
Well, maybe they just complain more. I'm not sure. But no, it's really not that bad. We can put a topical numbing cream on your skin, which really takes away a lot of the sting. And most people say it's a lot better than waxing or electrolysis, which I don't know because I've never had those, but I understand this is a lot better than that.
So let's see.
You have this beautiful lady here
Yes.
who's told us she's going to be willing to have you
Put our
try it out.
glasses
We all have to put our
Yes, we're going to put your
glasses
glasses on because we have to protect your eyes.
And this isn't really, I mean, we'll still be able to talk over this. It's not too loud, is it?
No, it's not too loud at all.
So tell us what you're doing.
So this is someone we're going to treat. We're going to treat her underarm first because that's one of the most common areas we treat. And it does fantastic results under the arm.
And it doesn't tickle.
Well, it's not bad.
No?
1, 2, 3.
Do you feel that, Lana? I know you don't have a
Yes.
microphone on.
A little bit. I expect her to go, whoa!
Oh, right. It isn't
No,
at all?
it's not bad. And that's all. And an underarm
what-
takes me 5
is that
minutes.
That's what I was going to ask you. 5 minutes?
Not even. I can do an underarm probably less than that.
So that's not, you don't do that with each hair, it's each area.
Well, it covers a circumference of 1 centimeter by 1 centimeter. So, you know, it takes maybe 10 or 15 little zaps and the underarm's done. A bikini line, an upper lip, those just take a few minutes.
Let's talk about what you are actually shooting at here. Where are you going? You know, we think of electrolysis, hair removal.
Right.
Where does this go into to actually remove the hair and prevent it from coming back, hopefully?
Okay, well, that's a really good question. What we're actually doing is the laser beam is going past the skin, so it's not affecting the skin. It's going deep down to hit the hair follicle because the laser is targeted on the melanin. That's the pigment of the skin. That's why it works well on people with dark hair because melanin is a target, and that's what lasers seek out. It's a target that it shoots for.
So I saw something interesting in the material you sent us, so that even those hairs you don't get out, so your hair is really dark, the hair would grow back with less color?
Yes. Sometimes we just injure the hair follicle. So what happens is even though a hair may grow back, it grows back smaller, it's less pigmented, it's not as cosmetically noticeable. So even then people are happy.
Are there people who, I'm sorry, are there people who should not have this done?
Yes, there are. If certain medications, if you're on medications which are photosensitizing, like tetracycline, you shouldn't be getting this treatment done. If you're on Accutane, which is a medication for acne, you shouldn't be getting this done. And then there's some people with some other medical conditions that we don't treat also.
If you're pregnant?
If you're pregnant, you shouldn't get it done either.
Okay.
And it's also, it's not 100% permanent. That's a really important point because people think it's 100% permanent. It's not. And even though someone may say it's 100% permanent, it's permanent reduction.
But you don't have to shave as often, which brings me to,
Yes.
I remember when this very first came out about 10 years ago, and when we did the story originally when it came out, they were telling us at the time, it does not work on men's faces. What's the story on that now?
Well, it does work on men's faces. It's just, it's hard to remove a whole beard area. I do have a few men that I do see routinely who I treat, and they get very nice results, but they don't get rid of their whole beard, but their hair is much thinner. They don't have that heavy beard. Now, where it works great is people with pseudofolliculitis or razor bumps. I'm sure we all know people with razor bumps. They're miserable with these terrible bumps, and we can treat them and significantly reduce those razor bumps with just one treatment.
So you do it here, you do it here. Is there any
I
scarring?
don't do eyebrows.
No
That's a good
eyebrows.
question. Yeah, because you're really close to the eye, and we don't want the laser beam to go near the eye.
Okay.
But you do upper lip, what's the most common areas?
Most
Upper
common
lip?
areas are probably underarm and
Okay.
bikini lines.
Okay.
And no
And then-
scarring?
No scarring. Well, theoretically, you could, but it just doesn't really occur if you go to someone experienced. So it's really important you go to someone experienced, and it's really important you use a good technology. There's lots of different lasers out there, but only a few are really good.
But do you want a certain type of doctor when you talk about somebody with experience?
Well, it doesn't necessarily have to be a certain type of doctor, but you do want to have a doctor who's experienced, and you can ask the appropriate questions to find out the experience. If you want to ask me, please ask me. I'll be happy to tell you the right questions to ask, because there are right questions.
Okay.
And if there's a nurse who's doing it, or a PA, which is a physician assistant, the doctor should be around.
Well, hopefully people can get more information on our website, and we'll link you to your website, hopefully, which will give people tips on how to find the right doctor, and much, much more. Thanks so much for joining us, and thank you for being our
Thank you, Lana. Thank you, Dr. Dayan.
Oh, my pleasure.
Appreciate it very much. Now.